Over the course of the last few weeks, we have been tracking those federal budget cuts as they begin to trickle down and affect programs and people here in Nebraska. One industry that has recently taken a hit are the state's hospitals. A program designed to prevent addiction to painkillers is now without the money that it had relied on. 1011 Sam Cobb spoke with those at the Nebraska Hospital Association to see just what this means for folks in our neck of the woods. He joins us live now. Sam?
It's an all too common story. An injury leads to surgery, which leads to a recovery that can often involve painkillers. For some patients, it's their first experience with narcotics, putting them at a higher risk of getting addicted while only trying to get better. Post-operation opioid addiction. That's the trend that the Nebraska Hospital Association's opioid reduction program, which only started last September, was meant to slow.
It's still a crisis that's hitting every part of our country. Every community in Nebraska is facing it in some ways.
The program's model was providing patients undergoing surgery in Nebraska hospitals with a personal nurse and a take-home pain relief kit featuring opioid alternatives like ice packs.
We really would restrict, if at all, the prescription of opioids after somebody left the hospital, trying to manage it through other means, maybe as simple as, more frequent usage of ice packs and higher dosages of ibuprofen and Tylenol.
The $3 million federal grant that funded the 12-month-long program was terminated just last week.
If they wanted to stop it at the end of the fiscal year in September when the program was supposed to be done and not renew it after that, that would make a lot of sense because at least you would get a baseline of data that you could use.
Now the participating hospitals, such as Memorial Community Hospital in Blair, are left with the plan, but no money to effectively carry it out.
This was totally out of nowhere. This is a program that we were very excited to start. The resources that we're currently able to provide for patients, such as the ice packs, such as the pain stimulator, will not be available for us to purchase.
Meaning they'll have to come up with other ways to ideally curb that potential for addiction. A federal judge temporarily blocked the cutting of the grant funds this program falls under just last Thursday, and 24 U.S. states, not including Nebraska, filed a suit to challenge the cancellation. But both of those cases are still active, and the opioid program will be unable to continue while they are
In limbo. All right.